Okay guys, I'm going to show you how to make a declaw bandage. What you need for a declaw bandage: 2 4x4 gauze sponges, which you're going to open lengthwise. You need 3 pieces of tape, approximately 7 to 8 inches long, depending on the size of your kitty. This kitty's got fat paws. On the third one, I'm going to make a courtesy tab on there so I can easily pull it off later. And then we're going to give you a glove. If your kitty's small enough, basically what I'm going to do is you cut a finger off that glove. You may get a whole glove, you may just get a finger. But what you're going to do is, normally this would be rolled up, much like your stockinette when you're making a cast. But this kitty, because his paws are so fat, I'm just going to open it up all the way like that to put it over, okay? So the cat will normally be still sedated when you put this on. So you're going to take your gauze, and I'm going to put it on the posterior part of the paw and then over the anterior part, over the toes. And I close that up. And then I take the other gauze and I put it over the toes, but over the lateral and medial part of the leg. And I just kind of wrap that around, like so. Then I'm going to put my finger cot over the top of that. Now again, this doesn't work really well because of the stuffed animals. They're just kind of big. So I'm just going to put it on and stretch. Normally you could roll this right over the top. The cat's paws and that fat. This one's pretty fat, so we'll see if I can get it on there. And if it doesn't work, not all clinics use finger cots, so certainly we'll still count it as good for you if you try. That's all that one's going to fit on there. It's not perfect. The purpose for the finger cot is it's elastic, right? And it's going to compress the paw. So part of that is to control bleeding, and the other part of that is to control pain. Think about the last time you hit your thumb or you stubbed your toe. You grab it, right? It feels better when you push on it, so it kind of helps. Now most clinics have really good analgesia in place. They do a local block. They'll do pre and post-surgical analgesia. So pain isn't really as much of an issue as it used to be, but this still helps. Okay. So now once you have your finger cot on, then I'm going to take my tape and I'm going to place it on the lateral part of the leg with just a little bit of the fur. I'm going to have that tape hitting a little bit of the fur, and then I'm going to put it around the tips of the toes and then down on the other side. And I made my tape just a little too long. That's not a big deal. There we go. Okay, so it's basically just hitting a little bit of the fur on either side. And then I do the same thing with my second piece of tape, but I'm going to put it on the posterior and anterior part of the leg. Like so. And I just kind of close that down. And then I'm taking my last piece of tape. And again, my kitty's leg is a little fatter than your normal cat's leg will be, so I got some extra space. I could put more tape around there. In fact, I will, just so it looks better. As you'll see, you want to just kind of close up those gaps of gauze. And then you're going to take that third piece of tape that has the courtesy tab, and you're going to place that proximal on the leg. Not too tight, just tight enough to kind of hold the bandage in place. That's really the only purpose of it. Having that courtesy tab on the top so you can easily grab it. Okay. So there's your declaw bandage. Then the next morning is when we typically remove the bandage. And obviously having someone help you restrain if necessary. You can grab that courtesy tab, remove that piece, loosen up all the pieces of tape. I put on more than you normally would because of my stuffed animal here. Just loosen those all up. Again, stuffed animal. Once that's all loosened, you should be able to just slide the entire bandage off. So you don't have to unwrap, you can just loosen and then just basically slide the whole bandage on. Okay? Generally speaking, there might be a little bit of bleeding when you remove that bandage from a declaw, but there shouldn't be too much. Especially if there's good analgesics in mind and the cat isn't too upset, you're not going to have pulsing blood pressure coming through, and there you go.